Hello, and welcome to or welcome back to How to Change the World, a podcast for people leading change in their work, communities, and lives. We explore everything that you need to drive meaningful impact on the local level and equip you with the inspiration and tools that you need to make change. I am Catherine Alonso, and I am joined today by Brandie Reiner and Terri Waibel. Brandie is the Executive Director for the National Association of Social Workers, the Arizona chapter. And in that role, she advocates for and leads development for social workers in the state. And Terri Waibel is the founder of the Center for Compassion. She is a licensed therapist focusing on those who are experiencing traumatic bereavement after losing a loved one. They join me today to talk about a really important piece of legislation that passed through the Arizona legislature this session. But to really frame it, I want to share just a sort of a hypothetical with you. So before this legislation passed, if you lived in any state in the United States and you were receiving mental health support from a social worker or a counselor and you needed to travel, so maybe you are involved in legal pursuit that has to do with your bereavement, which a lot of people are, or you need to travel for work, or you move, you are not able to receive support from your mental health professional, from your social worker in a different state, because every single state requires different licensing. And so your therapist has to be licensed in that state. And so national organizations focused on the professions of counseling and social work wanted to change this. And it is incredibly complex. A lot has gone into it. It's years and years and years of advocacy and storytelling. And Brandie and Terri are here today to talk to us about what that looks like in Arizona and the culmination of that change this year in 2024. I am so grateful to them for being here. And this is an incredible example of how really meaningful change is happening in our local communities. There is so much despair right now for what's going on in our world and the future, what it looks like for our civilization. And I think one of the things that gets really overlooked is the good, powerful, life-changing work that is happening and the incredible change makers that are dedicated to advancing that work, which is the entire reason why the podcast exists. But I just am super excited about lasering in on this really powerful example of how positivity, positive change, meaningful, life-saving work is happening. Before I jump into the conversation, I would like to ask you one teeny tiny favor, and that is that if you are enjoying this podcast, that you would please rate and review it on whatever platform you listen to it on. We have been receiving fantastic feedback since we've sort of relaunched the podcast earlier this year, and I'm so incredibly grateful for some of the reviews that we received. One from LSky162 is inspiring, uplifting, relational, and applicable. Wonderful podcast, wonderful stories. Look forward to upcoming episodes. So if you feel this way or any kind of way like that, I would so appreciate it if you would rate and review on whatever platform that you listen to. And with that, and without any further ado, please enjoy my conversation with Brandie Reiner and Terri Waibel. Brandie Reiner and Terri Waibel, welcome to the podcast.
Thank you, Catherine. Thanks for having me.
Glad to be here.
I am so grateful and so excited. Grateful for your time and excited to be having this conversation. So what I want to ask you both first is to tell me a little bit about the work that you do and also why you do the work. Why is it important to you? And how does it light you up? Brandie, let's start with you.
Okay, great. Thanks. I currently serve as the Executive Director for the National Association of Social Workers for the state of Arizona. There's a lot of responsibility that comes with that. I oversee not only our lobbying efforts, so advocating on behalf of our professionals in our communities down at the legislature, also at the federal level, and even at the local level. So, the school boards with school social workers. But then I also oversee the trainings and regulations as it's related to therapists. So anybody who is licensed in the field of social work in the state of Arizona. And I'm really grateful to be in this position and honored that I get to represent this profession that I love so much, both from an advocacy standpoint, but also getting to work with other social workers as well. I got into social work because I was a kid who was impacted by the system and was frustrated by the lack of resources that I had growing up. And now I don't ever want anyone else to feel that way. So it's really important for me in all the work that we're doing to remember not only my own experiences, but I really take to heart the experiences of the families and the clients that our policy and or our therapeutic interventions are impacting.
And Terri, how about you?
My name is Terri Waibel. I'm the founder and clinical director at Center for Compassion. We are a therapy practice that specializes in supporting the traumatically bereaved. So we work the majority of the time with families, individuals who've experienced sudden, unexpected, or out of order death of somebody that they love very much. And in addition to that, I founded the Southwest Institute for Grief and Trauma Studies, where we're closing the gap in grief education for helping professionals. And as a part of that work, and for me, grief activism, grief advocacy in the community, I was very humbly honored with being given the 2023 NASW Social Worker of the Year Award, which was just like, beyond something I could ever imagine for myself, which is very cool. And after being given that award, I made the decision to be a part of the board of directors for the NASW and of Arizona, NASW of Arizona. And one of the reasons I primarily made that decision, I told Brandie in the process of, interviewing to be a part of the board and all of that one of the primary reasons I wanted to do it was to support efforts with the Social Work Compact, because I saw how it was directly influencing our clients, the families that we work with, the very specific nuances related to grief and death and dying, and how travel in and of itself is something that really affects those family systems. And so wanting to be able to expand our services, that it felt really significant and important, both to protect colleagues and to protect clients, to be a part of advocacy and activism efforts in whatever way that I could. And I have done this work specific in the area of traumatic grief for over a decade now. I had my own experience of significant loss and was on the podcast with Catherine. You could hear more about that a few years ago. I had my own experience of significant loss and didn't find resources that would meet my needs therapeutically. And so developed what we have now as a practice in the hope that people are able to get their needs met in grief for therapy. So thank you so much, Catherine, again, for having us.
Oh, and I'm so grateful to both of you for your time today and for shedding light on your experiences in this last legislative session, but also just for the work that you do, because it's truly life-changing, truly life-changing. And I think just too often gets overlooked, and I'm grateful to both of you. So let's talk about the Social Work Compact and SB 1036, which went through the Arizona legislature this last legislative session, the one that wrapped up in the summer of 2024. So tell me a little bit, kind of in layman's terms, what does it do and why does it matter? Brandie, do you want to start?
Sure. So SB 1036, the Social Work Compact, essentially oversees licensure requirements for licensed therapists. So anybody who's getting their LMSW or anybody who wants to get their LCSW, those are different levels of clinical or experiential licensure. Currently, prior to the compact being developed and implemented, if an individual was licensed in, say, the state of Arizona and then moved or wanted to do therapy practice in the state of New Mexico, they would have to get licensed in both states. That's really time consuming. It's really expensive, and the laws between the states aren't consistent in what the requirements are. And so even though you may have been licensed in Arizona, it doesn't mean that your credentials and everything that you did here would transfer over. The compact seeks to eliminate that barrier for professionals. And so think of it as like a driver's license that allows you to, our Arizona driver's license allows you to drive in all the other states. This is what the compact does. It would allow mental health professionals to practice in any of the states that are participating in the compact, and you would only have to get licensed in your home state.
And what's the impact for the patient or the person that's receiving the support from their therapist or their social worker?
I'm actually going to defer to Terri on that one. And Terri, if you wouldn't mind, because your testimony was really compelling of how this actually impacts the individual client.
Yeah, I'll talk about that. And that's, primarily the reason that I got involved is that I was seeing the way that it was influencing our clients themselves. So, the way that it would improve care or treatment for clients is that if they themselves travel outside the state of Arizona, at this moment in time, with the way that our current legislation is, they would not be able to continue receiving services from their therapist who's located in the state of Arizona. And while seemingly it might, you might perceive, well, it's not that big of a deal. Perhaps they're traveling for vacation, or perhaps, they have a time period where they're out of town. But for our clients, for example, we have clients who have had experiences in which their child dies in another state or has something going on related to legal action. And I talked in my testimony about a family I work with whose child was murdered in another state. And as a part of that, they have to travel back and forth for litigation that's going on. And during the time that they're out of state, they're not able to see me or talk to me about what's going on related to, the next parts of the unfolding of legal action around those things. And so I was noticing that it was detrimental to them to have an established therapeutic relationship with a provider in one state and have that disrupted when they were traveling. And it wasn't as a result of a lot of time, even their own decision making. It was that they needed to be there for, proceedings, and they weren't able to continue seeing me and getting support around their needs. I hope that helps to answer a little bit of how it might influence people.
Well, it does. And I think that just based on my own personal experiences with mental health support, consistency is one of the most important parts of it, being able to build a relationship with a particular mental health practitioner or social worker. Is that right?
Yes, that's exactly right. And continuity of care is something that we talked about a lot throughout testimony between, the multiple people that testified and talked about their experiences, both personally and professionally, that establishing safe, trusted, and, consistent therapeutic support is really significant for people to be able to get their needs met. And it would be disrupted in terms of their continuity of care if they're not able to continue working with their provider anytime that they're outside of the state.
Yeah, that makes sense. So tell me a little bit then about the background of SB 1036. So this was a bill that moved through the legislature, and spoiler alert, was signed into law this legislative session. But I'm guessing that there's probably a long background or origin story of it arriving in the Senate this year. So tell me a little bit about that. Ground us in some context.
Sure. So the social work profession is one of the professions that has been talking about having a compact for years. The counselors recently introduced theirs, and I'm not an expert, but my understanding is they've had it now for several years. Because our profession oversees so many different areas, it took us a little bit longer to come together. So it started with getting funding from the Department of Defense so that we could begin having conversations, public involvement in the creating of this model legislation. And so for those who don't know, the compact has to have the exact same language in every single state in order for it to be adopted and adhered to. And so we spent, I think we've been working on it for 3 or 4 years prior to its introduction here, just trying to get that legislation, really tailored to what was going to be beneficial for all the states. And as mentioned earlier, every state is different in what they require for their licensure laws, and how many hours you have to do like clinical practice and what your background in education and what all of that looks like. And so we had to compile all of the, different 50 states licensure laws and then figure out like, okay, well, what makes the most sense? What is too restrictive in how many hours that you need for clinical supervised practice, et cetera. And that took us several years to do. There was a large coalition of the national organizations, so NASW, the Association of Social Work Boards, ASWB, the Clinical Social Work Association, and then CSWE, which is the accrediting body for our schools of social work and social work programs. So we all worked together and came together and negotiated this language that, like I said, took several years to finalize. And then I want to say it was in February of 2023, or maybe it was March of 2023, we had consensus and the language was put out that, for states to use. Most of us had already missed deadlines in our state legislatures to introduce it, with the exception of the state of Missouri. And so Missouri was able to take the model legislation. They were actually the first state to pass it. And they were the only state in 2023 to pass it. And so the rest of us had to wait until the legislative session in 2024, to move that through. There was a large coalition. So while we were all introducing it in the different states, and right now it has passed in 22 states, the other thing that's important about the compact is that 7 states needed to pass it in order for the Compact Commission to form and to begin completing rules and regulations of how we will talk between states, how we will share data between states, how we will recognize, for example, the state of Colorado doesn't have a background check required for their licensure, but in the compact language, it does require a background check. So the state of Colorado has to make changes to their law or a way in which they will do background checks so that anyone who wants to join the compact will then be compliant. So there were a lot of different conversations between a lot of us at states. NASW had put together a national task force, and there were about 8 individuals from selected different states. And I was serving as one of those, representing what we would consider a red state. Our legislature is pretty predominantly red, even though there is the, slight majority in both chambers of that, but also just the perspectives of how we regulate practice in general differs very much from, say, several of those states on the East Coast. And so we were trying to make sure that we were being mindful and incorporating, trying to catch everybody in this, but then also trying to help and support each other as it was moving through. And there are some states that have introduced it and it didn't get passed for, very political reasons of that. But there were a lot of states where it moved really, really quickly. In Missouri and South Dakota were the first 2 to pass it. We used that in our testimony to talk about hey, look at how many, states are passing it, and in a bipartisan effort as well.
And so when you came into the legislative session this year, you had to wait because of it had been too late to introduce the legislation in 2023. You were going in to introduce it in 2024. It had been successful in Missouri. How did you feel going in? Did you think this was on the scale of easy to hard? What were you anticipating for getting it passed through the Arizona legislature this year?
I definitely did not expect what happened.
Yeah, and I agree, Brandie. I was feeling like this feels like it's controversial. It feels like it's bipartisan. It feels like it is something that's positive for everyone. It feels like, there's nothing about this that would bring forth potential resistance. That's how I was feeling, even though I knew it would still be a challenge.
Well, and I think too, so once we had model legislation and we knew that we weren't going to pass it, the 2023 legislative session ended, we began work right away trying to find a sponsor for this. And then we began having conversations in coalition. And so we have a mental health coalition with the associations where we meet, and we knew that the counselors were going to run their compact again. We knew that there was another compact. And so we strategized together about, how can we all move this forward and work together for, a common goal. And even though I'm not a counselor, I still understand the importance of the counselors compact and very much wanted to help them get it passed as well. And so we had done a lot of groundwork. We felt really confident going in. Our sponsor was the second ranking Republican in the Senate. And, we didn't anticipate any of the challenges that we had. And also even when we started in the Senate, we didn't have any complications. It went through relatively quickly. And so we just were under the impression okay, great, this is how the House will follow.
And so where did that controversy that you weren't expecting come from?
So the bill passed out of the Senate and, had very little opposition. I think we understood that there was a caucus or I think it's maybe considered a coalition, certain elected officials who weren't going to vote for it. So we knew that going in. But again, it had really strong bipartisan support. And so then when it went over to the House and it was assigned to the Health and Human Services Committee, we anticipated that we would follow the same path that the counselor's bill was. And so their bill had, been assigned. It had gone to caucuses and then was put up, on the agenda. And we didn't anticipate anything until we were told from legislative staff and from an elected official that, our bill would be heard on a specific week. And when the committee report or the committee agenda came out for that week, our bill was not there, but the counselor's bill was. And so that's what really alerted us to, hey, something is wrong here. Like, it's confusing. We need to try to find answers to this. And the unfortunate thing is we couldn't really find a specific answer. We were being told a number of different things, like why it wasn't up. The first was like, it was just a mistake and it got confused with another bill. And the numbers were kind of similar. And so that's why the chair had left it off. In having conversations, with the chair, though, that was not the intent, and that our bill was actually left off for other reasons. And so, for those who don't know how the legislature works, I was having conversations because I am a registered lobbyist on behalf of the association, but we also contract with other lobbyists. And so we had 2 different lobbying firms helping us with this, and they were both working on it and having conversations. And so what came from that was, an elected official had said the bill is too trans and that they weren't going to support it out of committee, which was really confusing to us because our bill had nothing to do, with anything specific related to transgender care or individuals. It's really a licensure bill, and do social workers and therapists work with trans individuals or the LGBTQ community? Of course, but the bill doesn't specifically say that. Yeah. Another conversation. Go ahead.
I was going to say, and part of the reason that we had expected the same trajectory as the counselors is because the change in legislation was related to the same regulatory body that oversees counselors and social workers. And so it wasn't, the change was something that was going to be exactly the same. It was giving the exact same change in terms of, rights with a specific license to practice psychotherapy across state lines, which was just different in terms of discipline, but not different in terms of the actual legislation or rights or changes it was giving for professionals who have a license to practice. And it was quite confusing for us why one specific discipline might be treated differently than our discipline, when it was essentially, giving the same legal rights across disciplines regardless. And to speak to Brandie's point, if the bill was too trans, then why were counselors being treated differently? Because we would have the same rights to practice psychotherapy for any client, regardless if they're trans or not. And so I know that we were really sitting with this uncertainty about why we were being treated differently and why our bill was now suddenly in some ways felt like it was being targeted when counselors were just moving through fine with no unexpected hiccups. And I don't know if now is a time to talk about it, but I do know that conversation we had, Brandie, really shifted things for me in terms of my testimony. So
let's come back to the shift in your testimony. So I will definitely come back to that, but I want to ask a little bit more. So what did you find out in terms of why the 2 compacts were being understood and treated differently?
There also was confusion just related because, in language we have used social worker and counselor interchangeably in that. And so there were some elected officials who were like, but we just passed that last week. So why do we have to pass a separate bill? And so we had to explain to them that in statute we're legally 2 separate professions, and we needed a compact for each in order to govern our licensure structure. And that's when it became really apparent to me just how important language was. And then someone also had said, it says social work in the title, and social workers, tend to do more controversial things with clients, which was confusing, again to me. And I think that there's a lot of disinformation that's going around right now about what a social worker is and what exactly we do. And I think that was getting, mixed in with this. And so having the explaining to them, no, this is what social workers do. This is what counselors do. Also, this is what our bill does and that bill does. And so, to Terri's point about the language, we actually had everyone change their testimony when we did finally get a hearing in the House. And we actually removed the language social worker completely from it and really just focused on therapist. Because for us, we were like, if social work is controversial and this is where the hiccup is, what can we do to change this, to leave it? And I think one of the pivotal moments was, retired First Sergeant Daniel Brown came to the Capitol with me to talk about his own mental health struggle. And if his therapist had not been licensed in Texas and in Arizona, that he wouldn't have been able to get care. And additionally, that, he has a lot of experience losing members of his military comrades to suicide. And one of the things, that seemed to resonate a lot with elected officials. And so in social work, it's really big for us to meet people where they are. And I think at that point, it became really clear. We had talked about, how this impacts military families and veterans specifically. But that seemed to be like the only bridge of where they were like, this is how it helps military families. And the chair is also has Luke Air Force Base. And so we had other members, not just those that testified, but all the social workers were writing about, like, I support military members. We've had several former members of our board who also work for the VA who were sending letters. We worked really closely with the Department of Defense to help clear up any misconception about what this does and why the Department of Defense actually partnered with us on this for that. Yeah, I'm not really sure. I also know that the governor is a social worker, and we had heard things of like not wanting to support the governor's agenda of that. And so if the governor is a social worker, do we want to, pass a bill that supports social workers? So there were a lot of different messages that we were getting. I have no idea, which one of those was the strongest, but in terms of trying to like meet people where they were and help them understand what the bill actually did, we reframed our messaging and how we started communicating about the bill to elected officials.
And so that brings us perfectly back, I think, to the moment where you get a hearing in the House, and presumably it had been a little bit touch and go as to whether you were going to get that hearing. Is that right?
Yeah.
Okay, yeah, so you get the hearing? Sorry, go ahead.
I was going to say we were on the agenda, then we were pulled, and even the day of the hearing, we were told we were going to be pulled from the committee agenda, which was the last day that we could have been heard in committee, according to like legislative process and rules. And so it was really do or die that day in order for us to get out of the Health and Human Services Committee.
And at what month were we in at this point?
March. Oh man, we started in February. Is that right? And it was, it was so March.
Okay. Yeah. So it's the last day where you can testify. You think you're getting polled, and then, sure enough, you go ahead and you're able to testify in the committee. And so you have people testifying on behalf of the bill. So Terri, talk us through what you were going to say and how you shifted your message and what you did share.
Yeah. And if I remember right, we got through Senate first. This is a House committee hearing. And so I had shared a bit previously about like the financial impacts of this as a business owner and the ways in which it also would influence my staff, those sorts of things, really taking like a practical, pragmatic lens in talking about it. And, Brandie called me, and we had been in a lot of communication over time about the controversy, the resistance to it, some of the messaging that was going on. And, with her communication about, it being too trans, I just sort of felt like it was important for me to speak about the way this actually is affecting people's lives and, moving away from dialogue or discourse around finances or business or any of those things. I just felt really compelled that it felt important that I had to say what I had to say. It felt really critical that if this was the last moment, like I needed to go in front and have them understand how this could affect someone's life. And so I sat down within a 24-hour time period, did what I needed to do in terms of ethics to consider, sharing the information that I was sharing, and wrote something out that really brought light to the stories of the families that I work with and how the change in this legislation would support potentially them getting access to care at really acutely critical times in their lives following a traumatic death. And I, shared with Brandie that I felt like this was important to do. She was in agreement with me. And then we talked together about how we would discern the order of testimony following that shift. So does that all sound right to you, Brandie?
Mm-hmm.
And what was the impact of the story shared during testimony?
Well, my experience was that, Dan spoke first, his testimony went first, and it was incredibly profound. I mean, it was unbelievably moving. It was silent in the room. There was not a single sound whatsoever. People were just really compelled with, how significant his testimony was. And if you have an opportunity to listen to it, it's really moving and heartrending. And, following his testimony, I spoke then about the families I work with and how this could affect their treatment. And my experience similarly was that, they have a timer that goes off if you're going over time. Timer went off and one member of the committee looked at another and they shooed away the timer and, wanted me to keep speaking. And so I think similarly that it was pretty quiet in the room. People were, pretty moved by the depth of what we were talking about and really helping people understand the impact and effect of this. Does that sound right to you too, Brandie?
Yeah, it, like Terri said, it was silent, and we knew that if they would just give us a chance to hear the testimony that we've been working on, that we could influence their vote and help them understand what this bill was, even for the elected officials who maybe didn't meet with us. It was really emotional too, right? When people are sharing their own personal stories as it relates to mental health. But then we were really also, we tried to tell a story through it, right? And so there was a reason that I had asked if Dan would go first, because I think that number one, men don't really talk about needing access to mental health, and also those in the military, right? There's this stigma around like I needed access to mental health, and then here's what happens for the folks who didn't. And Terri has a background also coming from a military family and then working with families who are, grieving loved ones. Angela, who is also an NASW board member and couldn't be there that day, but she was going to testify about how her partner suffered and needed mental health services when getting, retired from the Marines, but also as a clinician now, trying to navigate the system. And so it was kind of twofold from her perspective on like a personal level, but also as a professional, here's where I'm struggling with that. And the cool thing about that testimony was there was also a student from U of A's public health program, I think. We had no idea that the individual was going to be there or testify and to say things. So that was kind of like a nice wrap up in that. Catherine, I'm wondering if I could talk about just like some of the stuff that happened before that and highlight.
Oh, please.
So there was another bill, SCR 1036, which dealt with like towns and cities or something. And there was an organization who was doing action alerts, as they should. And I, don't want to silence anybody and always encourage folks to be active. But what was happening is when individuals were signing in on the RTS system and signing in for the bill, they were actually
explain what the RTS system is.
Sure, the request to speak system. So the really great thing about, Arizona's legislative process is you can sign in just as an individual, and sign in for or against bills. And also you can provide, like a sentence or so about why you're supporting or why you want the elected officials not to vote for it. And so we had social workers signing in that morning, supporting of the bill. And to my knowledge, there had been no outside opposition to this. And we had several coalitions. We had over 300 people signed in just on the request to speak, but they can also sign in to testify or the day of. And so what I saw, on the back end when I went in and viewed it were people signing in against it. And it was really coming from this organization that had sent out an action alert for them to sign in against SCR 1036. And so we heard that morning from the chair and others from the committee, like there's just all this opposition to it. Maybe we should pull it. And so I was trying to frantically contact the member or the organizations to be like, hey, your folks are signing in against our bill. I mean, if they're against it, that's one thing and definitely leave it. But if they're not against it, could you send out another alert, having them go in and retract it from that, because it is impacting our ability to stay on this agenda for this committee hearing. And so that was all happening, even prior to testimony, and getting, just a chance for Dan, Terri, and them to all testify in support of the bill.
Hey everyone, Catherine here. If you're listening to this podcast, you are likely seeking to create change. And the key to creating change is bringing your audiences into your story. At Javelina, we work with our clients to develop impactful marketing strategies driven by three vital things: who you're trying to reach, what you're trying to achieve, and the why behind it all. And our marketing strategies help our clients reach more people and drive more impact in their local community. So if you are looking to elevate your impact, head over to javelina.co today to sign up for a free consultation. Let's bring your story to life.
Yeah. And I'll never forget just, they passed it through the committee that day. They said yes. And I'll never forget just seeing Brandie in the back of the room, and how moved she was. And, she was in tears because of how hard she had fought to get us where we were. And it's an image that's stuck in my mind since then because of how meaningful that was. And unfortunately, that wasn't the end of the controversy. We got it through House Committee, and you wouldn't expect there to be issue with rules, but there was. So I don't know if you want to take it from there or not, Brandie, but.
Yeah, and I think I was unsure because, we had tried to get the vote count, of that. There also was drama with, we thought we had an elected official, and then at the last, minute, the elected official was like, I'm going to vote no. And so there was some back and forth even coming up to it. So I became really emotional at the end of it because I didn't expect the vote count to be what it was. I knew that it would pass out of committee, but then when we only had two that voted no, that felt really validating for especially Dan and Terri, who had given such powerful testimony of that. And so I really felt like they had been seen and heard that day. And these elected officials, voted to support them in that. And then, as Terri mentioned, there generally isn't any issue with rules. Like I said, we spent years going through working with an entire legal team to make sure that this would be compliant in all of the states. The Counselors Compact had moved through rules really quickly, but we sat on rules for 7 weeks. And the back and forth was that there would be a budget allocation that would be needed for the state agency that oversees licensure, which is the Arizona Board of Behavioral Health Examiners. Again, this was confusing because the counselors would have needed the exact same thing. The fiscal note in both of our bills was literally the exact same amount of impact that it would have. And so, again, it was confusing in trying to figure out how we would get it out of rules. And I will forever be grateful to Kinman, who was one of our lobbyists. The day that Rules Committee came and we didn't, again, it's very last minute. Session is going to come to a close now with the last rules meeting. If we don't get out of rules, the bill dies. And so he was able to, at the 9th hour, get the chair to bring it up that morning in rules and get it passed out of rules. And then from there, it went to the House floor, and it had a hearing on the House floor. We're expecting everything to go well. The difficult thing that then happened, though, is that the legislature is now kind of in this hurry up offense, if you will. They're trying to pass all of the last minute bills, and then they're trying to pass the budget. And so our bill is kind of lost in there. But all these other bills that had been heard at the same time, they're getting passed. And so, it's the last day. It's a Saturday, June 15th.
I remember.
Of this year. And so it's Saturday morning, and, I'm messaging the team, and I'm like, how come our bill still hasn't been, heard for a full floor vote? And so I'm messaging them, and then it was actually an elected official who was on the floor, and I asked her, and I just said, can you go up and ask the speaker why 1036 hasn't been up. And that's the note that we got when they were like, it's been put on a majority of the majority list, which is a list and a rule that happens in the House where the majority of the majority party, which in this case is Republicans, and at the time we needed 16 of them based on the math, to sign this piece of paper to allow our bill to come forward. And so again, just another hurdle, and we spent the entire day and I'm, again, so grateful to the lobbying team of Creosote and Maverick for being down there and working with elected officials to get them not only to sign this piece of paper, and most of them didn't want to talk about it, right? Because they're wanting to talk about the budget and they're not wanting to vote for the budget, or they're wanting to vote for the budget, or they're wanting to make deals on the budget. And so our bill is kind of like, the last thing on their mind. And then in the last possible moment, the House had done all of its regular business and they're waiting to bring up these final budget bills for a vote. Jake got the Speaker of the House to suspend the rules to bring SB 1036 forward and for them to vote on it. And it passed with a huge bipartisan majority, and it was the last regular session bill to pass out of the House.
Mm-hmm. How did it feel in that moment?
I think I was just shocked that it actually happened. I messaged the team and was like, are we sure that nothing else can happen now? Because I was like, I felt like we needed to really account for everything. And I watched the entire end of session all the way until 10:30, until the Senate, just to make sure like nobody was going to recall our bill. And then it was really being sent to the governor's desk. I felt triggered, for lack of a better way to say it, based on all of the, adversity that we had gone through for this. But, there were so many times when I didn't think this was going to happen. And there were several areas, at least 3 of them, where I thought the bill was very dead. And for it to pass, and for us to be able to do that and also to pass a bill in the first year that we introduced it is just astronomical. So I'm incredibly grateful to everybody who helped us with that, because it really was an effort by the community. It was an effort by the social workers. We sent over 30,000 emails. And that's just the system I can track. That doesn't include people who were posting on social media or people who were making phone calls to the elected officials. And, that's other coalitions who are also supporting this, other mental health professions, other lobbyists were even trying to help us with it. And so, again, just incredibly grateful that the community really rallied behind this and helped us get it passed.
Yeah. And I absolutely remember feeling similarly of, are you sure? Are you sure? Like I felt like I had to keep checking to make sure. Also so much relief and a lot of gratitude and pride.
Mm. And so when you think about it now, we're a few months out, it was signed into law. We will enter 2025 with people in Arizona being able to receive more continuous mental health support, which, as we all know, is life-saving. When you think about it now, when it comes to creating change in this way, like creating law and policy that shapes people's lives, what is it that you learned?
I think, to just expect the unexpected always, but also to just be flexible in that. And, for us, we had backup plans of like, what will happen or what will we do if this happens, or what if that's going to happen. But also, Catherine, I really just think that it really highlighted just how a group of people can make change and can continue to advocate of that. And it's not that I didn't know this. I think sometimes when we get so entrenched in the legislative process, sometimes it's just like, well, we just have to meet with this elected official, or, if we make this deal or that deal, right? This was really about people sharing their stories and in, different areas of that. And so just how important each of our stories is, how valid it is, and how worth sharing it is. So, and also allowing people to be the advocates for themselves, in Terri's situation, saying, I know that this works in the Senate and, this may be what we're targeting, but I feel really compelled, like I need to do this for my clients, but, also as an advocate. And so trusting people when they come to us and say, this is how I would like to share my story, and understanding that even if that doesn't, fit in some sort of other messaging platform, right? In politics, we talk a lot about messaging and, what resonates and what doesn't resonate.
Terri,
Yeah,
how about you?
I was going to say, I think for me, it was a couple different things. One of them was how significant, a culmination of small steps can be in moving something forward, that like it wasn't one action that made this come to fruition. It was so many small things cumulatively that grew over time to move this in the direction of it actually getting into law. And I think sometimes that people have an idea that it's one sweeping decision or one big action that someone takes that changes things in terms of law, and it's this is just case in point in which it was so many small things consistently over time with so many people putting in that small effort in order to create the momentum to get where we got. I think the other part of it too that's like interesting, if we step back, as human beings and recognize that we're all just making it up. That's what laws are, is like we're making it up, right? And it was cool to watch, having something created that is meant to really make a difference and improve people's lives be something that we were making up but pushing forward, and having other people take a vested interest in that and see it come to fruition in the world and make a difference.
And how, for those listening, what I want to ask you both is, when it comes to influencing change through the legislative process as an individual, what is a resource that you might point people to where they can learn more about what that looks like? Brandie?
Yeah. For social work professionals, we do a legislative education and advocacy day. And I know that there are a number of other nonprofits and organizations that also do advocacy days. I would encourage anyone to, sign up if they're interested in that. So whether you're a social worker, a counselor, or a teacher, or, just interested in, like access to, food in the state of Arizona, right? There's an organization that also does those advocacy days. And the trainings are really meant to guide you to how you can continue to follow the process. So for us, for example, we sign everybody up with a request to speak system so that even if they're not able to make it down to the Capitol to testify because people have jobs and aren't able to take time off, they can still be a part of that process and feel like their voices are being heard, through that tool. People who are just making phone calls down to elected officials' offices or writing emails. And I know I've been asked several times, I guess I should say, does this matter? And our situation, it definitely mattered. It was the emails that actually got me into a meeting with one of the elected officials because, the social workers really rallied and they just kept sending emails when I asked them to. And then finally the elected official called me back and was like, okay, I need to understand this more. And so I wouldn't have been able to have that conversation had the community of social workers not continued emailing when I asked them to. So, the answer is yes, it does matter. And to Terri's point, there's all these small things that individuals can do. You don't have to become a registered lobbyist or you don't have to go down and testify. There's ways that you can stay engaged. I would encourage everybody to understand who their elected officials are, both at the federal and at the state level. And then, for those of us, who have kids or work in school districts, like it's also important to know who your school board members are. There's laws right now where school boards are removing funding for school social workers and school counselors. And so there's advocacy at all of these different levels that the individuals can participate in, at their own pace.
Yeah. And I was going to say, there's two different things I would say that come to mind for me in terms of resources or getting involved. And one of them is, one of the easiest things you can do is just go on the Arizona state website and watch proceedings as they're happening. I mean, you can do that from home and learn so much about the process, learn much more about the elected officials, the ways that they vote, what you might expect in a hearing, how hearing people's testimony, that is such an accessible way to get education around it that you can do right from your home anytime. And the other thing too is if there is a particular issue that you feel compelled to make change around or you feel passionate about, to reach out to some of the organizations that are involved with that and ask them, like, what legislation is there that could influence this? And what can you tell me about it? And is there advocacy or efforts around it? Because there are so many laws, there are just so many. And you don't necessarily think that the population that may be really important to you or the issue that may be really important to you has a law that affects them. But if you are in direct communication with the people that are working in those areas on a day-to-day basis, you can find out some ways that you could make significant change and bring light and energy and focus to something that other people may not be looking at.
Wonderful. I am so very grateful to both of you for your time and sharing the story with us today, but also just for all of your advocacy work and your passion for social work and for all of the people that it helps and that it changes their lives. So thank you so incredibly much. My last question is for anyone listening who would like to connect with you and your organizations, where is the best place that they can do that? Terri?
The best way to get a hold of me is probably at my email, which is terri@thecenterforcompassion.com, TERRI at thecenterforcompassion.com. And you can find our website at thecenterforcompassion.com.
Brandie?
The best way is probably through our website, which is socialworkers.org. And then there is, that's the national website, but there's also the state website, which is socialworkers.org /AZ. And there's an email on there that individuals can connect with us there, but also we post on social media. So we have Twitter, Facebook, Instagram. Our national office has a LinkedIn for anybody wanting to connect. And so if you message us there, it will give you information of, how to connect with us more directly. But we're also just always posting about events that individuals can join in or like advocacy efforts that we might be leading.
That's great. Wonderful. Thank you guys so very much.
Thank you, Catherine.
Thank you.
I really hope you enjoyed that conversation. I found it so profoundly inspiring and helpful, and it really jumped out to me how important messaging and storytelling is in creating change in the world. Brandie talked about how just the language around social work was really a barrier for them in advancing this legislation. And then the pivotal moment of being successful really came from when they shifted their storytelling away from the sort of practical administrative elements of this bill toward the meaningful impact it has on individual lives. And that was really what enabled them to overcome all of these barriers to passing this legislation. And it really underscores for me that knowing why you are doing something and then talking about that over and over and over really helps to propel powerful change. So if you are working on something and you think that your story need some work, then please reach out to us, javelina.co, because that's what we do. We tell stories that help organizations like yours advance change on the local level. So please reach out to us if that's something that you're interested in. And the other thing, just a last little reminder, if you enjoyed this episode, to go and rate and review it on whatever platform that you listen to. It means so much. It really helps us reach new people. And I'm forever grateful for your partnership. Until next week, when I cannot wait to share another story of change with you, have a great one.